the biggest driver of our debt right now, and that's what we're going to have to address. Then the third one was Richard Nixon, a Republican, was also a favored universal health care for everybody. Couldn't get it through, but he passed the HMO law, so that's where you have all these managed care organizations all over the country, and they were originally pretty successful in trying to kind of stabilize the costs, but they took it out of the hospitals. I mean, that's where a lot of the drivers are. So that's where, a normal delivery, for instance, used to be 5 days. I remember when I was in Virginia with a HMO out there, we cut it to one, and the mothers weren't real happy with that. But it was a significant cost reduction. And then the last one was actually the Affordable Care Act that was passed in 2010. So we've had four major inflection points in healthcare. I think that we've missed the opportunities. I don't know if there were any real missed opportunities when I think about it, but we were never able to come together as a country, because when you look at the fact that in the 1960s we were paying $150 per person for health care. That was under Eisenhower. Today, that's over $8,000. So I think it's the cost drivers. I think that if we don't do anything now, that's going to be the biggest missed opportunity we would have.
All right, well, we'll take a quick break. We're going to come back, and we're going to talk about the Affordable Care Act, as well as look at how healthcare is going to play a role in the upcoming election, looking at what Affordable Care Act is set up, but also what the Republicans want to do against it and why they would want to repeal it, what changes they'd want to make here. So we'll be back in 60 seconds. This is KagolTalk. I'm your host, Andrew Kagol. We'll be back.
We're listening to KagolTalk, broadcasting live from the Minnesota School Business Brooklyn Center campus location every Monday and Wednesday at 12:30 to 1 p.m. Central Time on blogtalkradio.com/KagolTalk. Brought to you by the Minnesota School Business. Looking for a chance to further your education? Visit them online at msbcollege.edu or head to
that takes the next 10 to 12 minutes.
Got it.
Perfect.
Minnesota School Business.
So we can run long, because you'll hear like a 90-second, 30-second. After that, then if we do anything, we won't be live on air. We'll just do like
Sure.
So we can certainly run over if
If I ramble.
Yeah, we take it too far. So.
KagolTalk. Feel free to call in at 646-595-4014. That's 646-595-4014. Now back to KagolTalk.
And welcome back into KagolTalk. I'm your host, Andrew Kagol. It's October 10th, about 2:50 in the afternoon. We are talking healthcare. Joining me today is a special guest, Michael Signet, who is the Healthcare Management Program Chair at the Minnesota School of Business, both at the Brooklyn Center campus and the Elk River campus. We just refer to him as Michael Z. Extremely knowledgeable and a great asset to our school and for the program. Before we get into talking about the Affordable Care, talk a little bit about the Healthcare Management Program here. We'll give you a little plug, opportunity to talk about the program and why someone would want to get into healthcare management in the 2012.
Yeah, the Healthcare Management Program is growing, and basically what I always explain that we're trying to do is to take the business side, because a lot of people, you get into healthcare to get into the clinical side, the medical assisting and all of those things. And what healthcare management is really all about is studying the business of healthcare, actually everything that we're talking about today. So the students that get involved in it want to get into healthcare. They don't want to get into the clinical side. They want to be into service. And what we're trying to do at these campuses is to really drive the innovation, because one of the things healthcare dramatically needs, even those working in the industry today, we need innovative, creative thinkers. We need entrepreneurs. We need people who think outside the box, because healthcare is very rigid in how it thinks. So we spend a lot of time in my classes anyway on the Affordable Care Act, the changes that are happening in the business side of healthcare, the politics and policy of healthcare. So people who want to get into, like I said, into healthcare, but don't want to get into the clinical side, maybe we want to get into marketing, maybe want to get into accounting and financial management, public health, any of those types of things. Because one of the neat things that especially with what's happened in the economy the last couple of years, healthcare is the only industry that has continued to add employees. Since January of this year, I believe the number is over 200,000 positions. A lot of them are clinical, but there are a lot of opportunities in community health, in information technology, in marketing and sales. So it is a growing industry. And what we're trying to do is to prepare the students, and when they go out into the marketplace, they understand the environment that they're going to be getting into. Because most people, even the people in the industry today, don't understand, I would say, half of what the students walk out of here with. So it's a good program. I've been very excited
All
about
right,
it.
well, thank you for the insight on that. Now let's talk Obamacare. That seems to be a hot topic, hot button.
Everybody has an opinion.
Everyone has an
about
opinion
it.
on it, whether it's right or wrong.
Nobody knows about it, but everybody has an opinion about it.
Absolutely, I said, yeah. We were talking a little bit about the show before the show about this. So it got passed because it was, as you referred to it as a perfect window of opportunity: Democratic, House, Senate, and President.
Yep.
But why is it so controversial?
It was marketed terrible. It was communicated very poorly.
How so?
People didn't talk about it. It was 1,000 pages. They picked out the things that they wanted to hear about and didn't hear. Because if you ask most consumers right now, most of them, I would say, the last numbers I've seen, probably 60% are against Obamacare in total. When you ask them about getting rid of pre-existing conditioning and allowing students to stay on their parents' plan until 26, people were going, "Oh, I like that." So there were parts of it that people liked, but overall, the packaging of it and the communication of it to the average consumer was very poor. I took the 1,000 pages of the Obamacare Act and kind of summarized it into, I think it's like 12 or 13 pages. That is the most downloaded document that I've got on my website.
Okay.
Because people, they walk out of there going, I had no clue that it was all about, that all of these things about taking care of the healthcare workforce, focusing on public health, creating accountable care organizations, that was all a part of it. All you hear about is the fact that we're forcing everybody to have health insurance, and we don't like that. And so basically it's the communication and marketing from the Obama administration, I think, was atrocious.
Okay. So, I don't want to talk politics as far as, if you're Democrat or Republican, I don't know what I am, so I don't care. I don't need to know. But do you think Obamacare can work?
I think it needs to be dramatically fixed.
Okay.
I'll just tell you personally, I have never been a huge fan of it.
Okay.
Because it is too big, too expensive. But I was saying it's a start. Let's have the Republicans and Democrats come together and take out the things that don't make sense from a public policy standpoint, keep the things that do, and at least we're taking a step forward.
Okay.
So I think the act itself, one of the things people do need to understand is going back to the fragmented healthcare system that we've got, we've allowed people to stay out of it if they want to. But what has happened is people stay out of it until they need it, and then they come in. Speaking from an insurance company standpoint, you cannot price that risk.
Okay.
Because that's the reason we've got Medicare, we've got Medicare, Medicaid, we've got the VA, we've got private insurance, we've got individuals, and we've got everybody who's staying out of it. And until we get everybody into the risk pool that participates, there is no way you can price for it. Because, again, you're going to get adverse selection. Only people that need it are going to come in and get it. And that's the adverse selection that we've had. And that's one of the reasons that our healthcare system is always going to be more than anybody else in the world because of what we desire, what we want. We want that freedom to choose, etc. But the other thing to keep in mind, the Institute of Medicine released a study just I think it was last month, that over half of what we spend in healthcare, we spend about $2.5 trillion a year, about $700 billion of it, they determined we waste. And that is because of duplication, fraud, inefficiency, all of those types of things, consumers not taking care of themselves. And my argument would be, hey, let's get rid of the waste and all of those things first, then we can start talking about insuring everybody. So it's kind of a different approach, but I'm saying, it's the first healthcare legislation. Actually, it's the most expansive ever, including Medicare. And it's something that we need to work on as opposed to just saying, oops, don't like it, let's start over.
Okay. So what would you take out of it? I see from what you're telling me, it sounds like you'd be in favor of having everyone in the pool.
I think we need to eventually
Okay.
have everybody in the
But
pool.
of some of the big hot button things, what would you change? If you had keys to the legislature and say, hey, here's what I would impose, what would you want to see changed?
I would have focused on the delivery inefficiencies first before
How so?
getting hospitals and doctors to work together,
Okay.
getting people to talk more, getting electronic medical records so I don't have to fill out the same information 5 times before I finally get care. All of those, and I would also really focus on the public health aspect, really focus on getting the consumers, and I know we don't like to hear this, but we do need to be healthy. We need to eat better, exercise. We need to, all of those types of things. Then I think that once you got those inefficiencies out of the system, then you could start to get everybody included. Because my argument has always been too, you're bringing more people into a broken system, and that doesn't make a heck of a lot of sense.
Okay. We have about 3 minutes left here. Then after we'll do our after show, and we're going to talk a little bit more about the Mitt Romney, what the Republicans would want to do,
Sure.
Things like that. But getting back to Obamacare, so we'll stay live here for the next 2.5 minutes here. What do you think of having all these tax credits and not kicking people off, or denying people based on pre-existing health conditions? Like, is that a good thing, bad thing? Because earlier you were talking about how that's what I think the administration did to get people to like it.
Well,
What
they
is
did
that?
that to get everybody in the pool, and that's the thing. The tax credits again, and the pre-existing condition. The fact that we exclude people, and 60% of the bankruptcies in this country have a medical-related component to it, makes no sense. So I think that the pre-existing conditions, because one of the things the health insurance companies said, we'll get rid of our pre-existing conditions as long as those 30 million other people start coming in to have health insurance. That's the reason that they did it. So as soon as we were talking about getting rid of requiring everybody to have insurance, health insurance companies were starting to go, well, that's not part of the deal we signed up for. So the tax credits pre-exist, that's all a mechanism economically to get everybody into the pool, and we definitely need fully support. If we're saying that's one of the first priorities, we absolutely need to have that.
Okay. In the final 90 seconds, so if we were to get everyone into the pool, would that essentially drop the costs to the
Over time, it would.
Okay.
Over time, because you're going to get both healthy and sick into the
Okay.
pool. They're able to price. You're able to predict. And over time, and as long as we focus on the inefficiencies also, you would do that.
Okay. I look at it from, to play devil's advocate, why would I pay for something if I don't need it, though?
You're never going to need health insurance?
No, I'm saying right now,
Yep.
possibly, or why would I want to pay that much?
Over time, you're going to spend $700,000 in your lifetime on health insurance.
Okay.
And just because you don't need it now and saying, okay, it's kind of like auto insurance, everybody's seat belts, all of those things. My argument is always everybody's going to need it sometime.
Okay. But why not, and maybe this is the issue, is why not just start paying for when I need it, though? Like,
Because you're going to be expensive.
okay.
All right. It's called spreading risk.
Okay. Well, final 30 seconds here of KagolTalk for Wednesday, October 10th. I want to deeply thank our special guest here, Michael Signek, who is the Healthcare Management Program Chair for Minnesota School of Business, Brooklyn Center campus, as well as the Elk River campus. This is KagolTalk. Join us every Monday and Wednesday from 2:30 p.m. Have a great day. And welcome into the sound booth. This is our after show here, and we're going to continue on from our previous conversation that we had here. So this is only on the podcast, available on the podcast. I'm Andrew Kagol. Joining me talking healthcare, and we've been talking quite a bit about healthcare, about the Obamacare. Now I want to get in talking about the Mitt Romney / Republicans approach here. So joining me is Michael Signac, and we're, what clearly